Welcome back. We're discussing efforts to save the lives of mothers and mothers-to-be in the developing world. Just to remind you that in the short time the show has already been on air, another dozen women have died because of complications during pregnancy or birth. That's one every minute, according to the World Health Organization. We're joined from New York by Juliana Yati, UNICEF's Senior Advisor for Maternal and Newborn Health, and also in New York, Ritimi Sankara, Coordinator of the African Public Health Alliance based in Nigeria. Let's get back to our discussion right now. And Dr. Yati, I want to go straight to an email that we received from one of our viewers in Norway. This is Benjamin, and he writes, I'm curious as to how developing countries are improving the education of their health personnel so that they are less dependent on foreign expertise.
Yes, foreign countries right now, mainly developing countries, are working together to review the curriculum of institutions, medical institutions, and nursing and midwifery institutions. WHO has been working, the World Health Organization has been working with countries in developing the relevant curricula to ensure that health workers in developing countries with high maternal mortality have the requisite skills to be able to attend and address complications in childbirth. They also have included in these curricula not only the clinical care, but also skills on program development to address various aspects of training for maternal and newborn health. There is a lot of ongoing training of health workers as well, not just in service, not just pre-service training, but in-service training of health workers who are already employed on the job do receive constant retraining to ensure that they are up to date on clinical skills and issues.
Now, have you found, as you point out, the training is ongoing, but have you found, and have you been able to measure the improvement as more and more people get trained?
May I say a few
No,
words
that
on
was
this?
Go ahead.
Okay. There are huge political problems with this. On the one hand, the countries of the developing world are not training enough. And even those that they are training, the working conditions are not good enough to retain them. And this includes their remuneration as well. But on the other hand, the more developed countries, many of them are not helping matters. There are huge percentages of health workers working in the US, in Western Europe, in Canada, that have been trained in the developing world. And these health workers have now been employed in more developed countries. Of course, there are issues of better working conditions and pay, but the main issue is the more developed countries themselves are not investing enough in training their own health workers. So there is a gap in those countries which necessitates their making up the shortfall from the developing countries where these health workers are most needed. Now, the high-level task force on innovative financing is trying to help bridge this gap by trying to raise more money through innovative financing mechanisms to train more health workers and to retain them. And this is good. But it is very, very, very important that the more developed countries themselves stop this practice of recruiting wholesale from the developing world to make up gaps for lack of investment in training in their own countries.
But having said that, there are also initiatives out there in these developing countries that are working at ensuring that there's retention of these health workers in countries. In fact, UNICEF, WHO, UNFPA, and the World Bank have been working closely with countries on how to train more health workers, define other cadre of personnel that could fill the gaps that have been identified in the short term and equip them to contribute effectively to the human resource gap. There's also an effort to ensure that the existing health workers are adequately motivated, because let's face it, in most of these countries, the health workers aren't motivated. They don't have the resources to work with in facilities, and that is why they are attracted to other opportunities outside the country. So there's a very important need to ensure that these health workers in developing countries are motivated enough to continue to stay in their countries and attend to maternal and newborn issues.
Dr. Yati, I want to look at something else as well, and that is we've been talking about maternal deaths and the deaths of mothers at birth. What about family planning? Do people in developing countries have access to family planning services? And how does an organization like, say, the WHO deal with unwanted pregnancies?
Family planning services, as I said before, is very critical. In fact, we think that it's a fundamental issue in that every pregnancy has to be wanted, every child has to be desired. And if pregnancies are wanted and desired, the likelihood that women would have unwanted pregnancies and that would result in abortion is therefore limited. Limitation of unwanted pregnancies and abortions would also lead to a reduced maternal health, because as you know, abortions alone contribute 13% of global maternal deaths. So family planning is a very important intervention that we promote. Women should have access to the interventions in all facilities. They should have access to various options. They should be adequately informed, and families should be empowered and equipped to use these services.
Mr. Sankara, I want to go to another issue, and that is we've been talking about mothers dying at birth. What happens to their babies? What has been your experience in working in Africa? Because there are many babies that are born and their mothers die at their birth.
Yes, quite sadly, this is one of the fallouts of this problem. Well, often what happens is that if mothers die giving birth and the children survive, then of course the children's chances of dying are then increased as well. In Africa now, we're losing about 5 million children under the age of 5 every year to various causes. And obviously, a child's vulnerability increases if the child's mother dies at childbirth. It's a very huge and complex issue, because now we're going outside the area of health systems and social determinants and so forth. Now we're looking at the society as a whole. A lot of the countries where this happens also do not have the social infrastructure to be able to look after these children. So it's really a very huge issue as well.
Dr. Yati, the United Nations Millennium Goal is to reduce maternal mortality by 75% by the year 2015. Is that within reach?
Well, currently, according to recent reviews, we're lacking progress in that regard. But the good news is that the efforts by all global partners, there's that recognition that MDG 5, that is achieving improvements in maternal and newborn health, is the MDG that has seen the slowest progress. And therefore, there seems to be a global consensus and efforts by all partners to accelerate action to achieve MDG 5. Let me take this opportunity to tell you about this, what the UN is doing in this regard. The 4 health agencies, that is UNICEF, UNFPA, WHO, and the World Bank, have come together to put our resources and our efforts together to support countries to accelerate progress in achieving MDG 5. What does this mean? It means that we're trying to use the resources that are available, harness the resources that are available right now to eliminate unnecessary waste, bureaucracies, systematic issues, use the resources to strengthen health systems, ensure that the human resources that are needed are available, ensure that the drugs and the supplies that are needed by these health workers are available with the resources that are being given. An example is what was announced today by Gordon Brown, the high-level task force, ensuring that those resources go directly to countries and that the 4 UN agencies which have the technical capability and the comparative advantage of being in all these countries and working directly with governments will support the governments to develop the appropriate plans that are necessary at this time to accelerate progress to achieve MDG 5 and 4. So this is an initiative that is ongoing right now with all 4 agencies supported from the highest levels of the organization to ensure that we achieve MDGs 4 and 5.
Dr. Juliani Yoki and Mr. Rotimi Sankare, thank you for joining us today.
Thank you very much.
Thank you.
And that is all we have time for today. Thanks for being with us. Remember, you can follow the show and get updates on the topics we cover via Twitter. Be sure to tweet your questions and comments for use on our program. On the next show, Riz speaks with billionaire entrepreneur Richard Branson about the need for environmental activism, as well as his latest venture, space tourism. That's all from me and the team. See you next time.